Hi, I'm Dr. Jaclyn, a general dentist at Dental Designs. So today's question is it painful to have a dental crown placed? This is a question that I get a lot from patients because generally as humans we are programmed to fear pain. So this is a survival mechanism. But the answer is no. It does not hurt to have a dental crown placed. And I'm going to go through why that is the case. Whether your tooth has been root canal treated before or if it's a vital tooth with the nerve intact, local anesthesia is a really important part of any operative procedure in modern dentistry. Without local anesthesia, we would not be able to perform many of the procedures that are considered very common. And the keys to having the least painful local anesthesia is number one, we need to have enough time. Number two, we need to have enough and the correct type of topical anesthetic. And it comes down to the injection technique. So let's talk about these three factors. Number one is time. So when we are preparing for the local anesthetic injection, I will usually place topical anesthetic on the gums where we are going to do the injection. It will not completely remove the sting of the injection, but a really well formulated topical anesthetic can be really helpful to remove that sensation. And that topical anesthetic needs to be left on the gum to soak in for at least 5 minutes. If the topical is not allowed to soak in for enough time, it's not going to be as effective, so that means the injections would be painful. The second, I've kind of mentioned it, is the topical anesthetic. There are many different formulas available with different ingredients. I personally like a compounded topical anesthetic. So what that means is it's a specially made blend of topical anesthetic with different anesthetic agents combined together, and this is made by a compounding lab. I found this to be much more effective than the commercially available topical anesthetic gels. I've even tried it on myself, so I've done like a side-by-side comparison and it definitely helps. And the last is the injection technique. So for some patients, they might imagine that you need to inject really quickly to get it over with. But we must remember that we need to give a very slow and steady injection because we want to give the tissues time to stretch out. If you inject the solution too quickly, that can cause very unpleasant tearing of the tissues internally, and this can manifest as a burning sensation. So we want to inject it really slowly. And the second thing that can help as well is to warm up the anesthetic solution. So if you warm it up to about 50 or 40 degrees, it's much more comfortable than injecting room temperature or cold solution. So after we've done our anesthesia, we need to make sure that both the tooth, the nerve inside the tooth and the surrounding gums are numb. So your dentist can do this in a few ways. For soft tissue, that means a gum anesthesia, it's usually quite reliable. Where you deposit the anesthetic, that's where the patient will get numb. There are other signs like blanching, where the tissue turns a little bit white, and we know that's the area that is numb. For the nerve of the tooth, it can be a little bit more tricky to test. In patients who've had a history of painful dentistry in the past, so maybe you've had fillings or other crowns or other extractions done before. Some patients do report that even though the dentist has given them local anesthesia, they still felt pain or sensitivity during the procedure. So for these patients, we might want to do additional testing on the nerve of the gum. Some patients are just more difficult to numb than others. So usually a cold test of the tooth that's going to be treated will tell us if the patient is able to feel the cold. It means the anesthetic is not effective. And we need to top up or explore other strategies to get the anesthetic to be more effective. For these patients who had a history of difficult anesthesia, there are a few factors that may be contributing to it. Number one, they may have additional nerve supplies from other nerves which are not commonly blocked by the conventional method of giving anesthesia. So if that is the case, and we suspect this to be a strong possibility, we may have to give additional anesthetic at different sites that we normally will not do, just to make sure that we hit these additional branches of nerve fibers. Some patients may have chronic low-grade inflammation around the roots of the teeth, especially if they grind their teeth, or if you have a really severe toothache on a particular tooth, there may be really severe inflammation around that tooth, which can make it more difficult for the anesthetic to work effectively. So for patients like this, we may want to give you anti-inflammatory pain medications an hour before. Sometimes I will even start patients on low dose of steroid just to bring down the inflammation, and this will increase the chances that the local anesthetic will be able to work effectively. Another thing is time again. Some people take up the anesthetic very slowly. For certain anesthetic techniques like regional blocks, these techniques will require that you actually wait quite a long time for the nerve block to become effective, sometimes up to an hour. So if we take all of this into consideration, some patients will have to have their anesthesia given quite early, combined with these anti-inflammatory tablets to help the local anesthetic be effective. So now that you have become successfully numbed and we have checked with the cold test, the rest of the crown procedure, the preparation, should be pretty much painless. The anesthetic will remove the sensation of pain. It does not remove the sensation of vibration or pressure or movement. So feeling all of that despite being anesthetized is quite normal. Most of my patients actually are quite relaxed. Some of them fall asleep during the procedure because they are numb and they are comfortable. At Dental Designs, we tend to do same-day crowns. So what that means is the patient comes in the morning to have any old fillings or decay removed. We will usually put a base filling on the tooth just to protect the innermost layer of the tooth. And we'll do a scan of the prepared tooth and send that to the lab. In between the prep appointment, which I have described, and the fit, there will be a period of a few hours. Of course, there's no anesthetic that we have that will last for that long, so it's normal as the anesthesia wears off for the tooth to get a little bit sensitive. Most patients can manage pretty well, but when we come back for the fit, which is usually at the end of the day, I will always top up the anesthetic because when we are gluing the crown onto the tooth, we need to do certain things like cleaning the tooth really well. We need to dry the area and keep it really dry as we are cementing the crown. So all those procedures can be quite painful to do if the tooth and the gum tissue is not numb. So basically a standard to refresh the anesthesia just before we do the cementation. And after cementation, we want to make sure that we don't leave cement behind because that can irritate the gums. So we do need the gum tissue to be numb as well so that we can clean out the excess cement that may have run under the gum without causing pain. So in summary, you can see we have lots of ways to make sure that the crowning process is essentially painless. A lot of it has to do with personalizing, the local anesthesia approach. So you need to have a word with your dentist about your previous history. For some patients who are quite anxious, I may even combine local anesthesia with other types of sedation to help the patient feel more relaxed. If you're more relaxed, it's generally easier to get the teeth numb. So I think with modern dentistry and the modern way of approaching anesthesia, you basically have nothing to fear when it comes to crowns, preparation and fitting. It should be pretty much painless. I hope to see you very soon at Dental Designs. If you have further questions, you can always send us an email or check out our social media like Instagram, and maybe, who knows, one of your questions might be featured as a future video. Bye!